Judging from the signs of the times, it's a race against the coronavirus as the world rushed to come up with a vaccine to quell the noise of a raging pandemic. But then, that is not all to what the pharmaceutical sector is bothered about today. Wondering what else? I'm just as curious. Now let's process all there is to know on that and several other issues with my guest for the next half hour. My name is Blessing Abu. Welcome to the program. My guest was born in Zaria, Kaduna State on May 13, 1956. He attended Barewa College, Zaria for his secondary education. He holds a Bachelor of Science, that's in Pharmacy, and also Master of Business Administration, specializing in pharmaceutical marketing from Ahmadu Bello University, ABU Zaria. For his PhD, he went to Usman Danfodio University, Sokoto, Nigeria, where he defended his thesis on drug distribution in Nigeria. My guest is a member of the National Institute and a fellow of the West African Postgraduate College of Pharmacists. My guest has been a consultant and resource person for the West African Health Organization, while the headquarters is in Burkina Faso, and has undertaken several professional and management programs in various universities and institutes locally and internationally. I was the managing director, CEO Zazo Pharmaceutical Industries Limited in 2000 and 2003. He was banned in 2013 by the Emir of Zazo and Chairman Kaduna State Council of Chiefs, the Lajisho Idris Aziwa killing Magani Zazo of the Zazo Emirate. I'm sure you know, though, for those of you who are non-Hausa speakers, Magani, of course, is medicine, so that shows he's still in line with his area of specialization. On the spot today, I'd like to welcome the Chairman, Governing Council of the Pharmacists Council of Nigeria, Professor Ahmed Tijani Mora. Welcome to the program.
Thank you, Blessing. Thank you very much.
Yeah. Yes, sir, just a great CV for you, and I'm sure in the work for pharmaceuticals, you've seen and you're still seeing so many things. So I'd like to start with that. You've practiced pharmacy as a core area, the profession, across academic, industrial, the industrial area, administrative, as well as community practice. This wide range of experience, tell us about it. What is your greatest tool in this area?
Well, thank you very much for that question, Blessing. My greatest pool in that area is actually in seeing to a better pharmaceutical services practice in Nigeria. Essentially speaking, I'm concerned about good manufacturing practice and ensuring access to good medicines for all Nigerians. I'm also interested in the referral system. I'm an advocate of a referral system in the healthcare industry in Nigeria, from the primary to the secondary to the tertiary healthcare services in Nigeria. But that's for another day. We're talking about pharmaceutical Pharmacists Council today. So it has exposed me actually to all the four core areas of pharmacy practice. I'm talking about hospital pharmacy, pharmaceutical manufacturing industry, the wholesaling and importation, and also the academia, like you said, across 3 universities. Ahmadu Bello University, Zaria, Kaduna State University, where I was the foundation dean, and now at Igbedo University, Okada. So, Federal University, State University, and the first privately owned university in Nigeria, Okada University.
Okay, well, before we get into area of academics and what pharmacy is today as it's being taught, let's take a look at efforts by the Pharmaceutical Society or the industry generally in addressing the pandemic, which is called for every living human being today. And I'm sure you want to tell us what are your concerns as it concerns getting the vaccine, getting the requisite drug to actually address ailments generally. This is not the usual time for the world, and unusual times of course require unusual system to address it. Share with us what the council is looking.
These are challenging times for every pharmacist, for every member of the healthcare industry actually. The Pharmacists Council of Nigeria, let me define it actually, is a regulatory agency of the federal government under the supervision of the Federal Ministry of Health and responsible for the regulation of pharmacy, education and practice in all aspects of ramification. During the inauguration of the Governing Council, the Honourable Minister, Dr. Osagi Ehanire, actually threw a challenge to us to look at this area of how we can intervene, as it were. Now, to begin with, the pharmacist is in charge of the hospital pharmacy in the secondary healthcare facility, that is General Hospital, and the tertiary healthcare, that is the teaching hospital, Federal Medical Center, and other specialist hospitals. So we have actually advocated that the directors of pharmaceutical services, the 37 of them, all state of the Federation and Abuja, should ensure that the hospital formularies in the hospitals are such that there are enough ingredients for the production of the hand sanitizer. Let's start with that. The issue is don't get infected. Now, every hospital pharmacist knows that he or she must draft a hospital formulary, and so the ingredients should be requested for to ensure that the hand sanitizers at least should be produced. Secondly, the issue of frequency of inspection by the Inspection and Monitoring Department as far as pharmaceutical manufacturing facilities are concerned, and with the pharmaceutical inspection committees for the retail outlets are done with more frequency now, you know, so that people do not capitalize on the emergency nature of the situation right now and begin to produce substandard or fake products. But
they've already started.
Well, that's what we're saying now. I mean, this is the new charge now to the staff of the Pharmacists Council that we're looking into. There is now increased frequency of inspection and monitoring. We have state offices all over the country. So with that, they have been charged. So that, and they have been encouraged, the registrar, the chief executive officer, has been charged to ensure that there's frequency of inspection in outlets, which we call pharmaceutical premises, where pharmaceutical endeavors take place. So this is by way of a regulation that we are doing. And then thirdly, the pharmaceutical manufacturing industries in this country, there are about 200 of them right now, have been encouraged to produce immune-boosting pharmaceutical products. We all know them. I mean, I'm talking about the ascorbic acid, that is the vitamin C that is over the counter anyway. So anybody can just access it and buy it and boost your immune system and so on. And then the public health role of the pharmacy is also called to question, actually. Whenever citizens access any community pharmacy, the community pharmacy should be in a position to inform and educate the citizenry on the type of food to take, what to avoid, and what to do to ensure that you don't get infected.
So you've raised so many areas that already I was waiting to latch onto. Let's take, for instance, the over-the-counter medications that you get to see. Are Nigerians, or perhaps it's not just a Nigeria thing, it could just be anyone who wants to just go across, especially for the kind of distribution system we have in the nation. People just go and people just go ahead to just, okay, I know A, B, and C had this when they fell to XYZ ailments, so I'm just going to go around and just get same thing. How do we handle that aspect so people just will not go just for the fun of getting pharmaceuticals or medications that is not intended for ailments that could even be more serious than what they're presenting? Especially in the days of COVID-19, people are actually fearful of getting to the hospital now. They would rather just go, okay, let me get to the pharmacist and I'll get something. What kind of regulation is being looked into?
Actually, pharmaceutical premises, they are there for the superintendent pharmacist to supervise, and he must be there all through, because it's a professional practice between the practitioner, the pharmacist, and the patient who walks in, or somebody who intends to buy a medication. The issue is this: there are certain drugs that cannot be dispensed without a doctor's or dentist's prescription. These are ethical preparations, and the categories of drugs that you are mentioning certainly fall within that. So no right-thinking pharmacist registered with the Pharmacists Council of Nigeria will go ahead and dispense medication without prescription. But there are over-the-counter products that are within the purview of the pharmacist to dispense, or the patent medicine dealer to also issue out. Yes, these are palliatives and these are immune-boosting pharmaceutical products that can be done. So the issue is this: we have gone beyond people just walking into a pharmacy practice and requesting for or ethical preparations and for the pharmacy to dispense no.
Okay, so I was saying in the sub-region now, like it's or even within the country, the issue, I mentioned the sub-region because I know at the points, wow, it's
West African organization, exactly.
Yes, you still have to take a look at some of the activities there. Sale of pharmaceuticals becoming more of a trade than that of profession. How fearful is this for practitioners?
You see, healthcare, there are 13 health regulatory agencies in Nigeria. And out of the 13 health regulatory agencies, it's only pharmacists. It's only the pharmacist who produces something tangible.
Exactly.
Three-dimensional, of high intrinsic pharmaceutical value. Pharmaceutical product.
Okay.
We are the only one who produce something tangible. So that's why the trade component comes into effect. And essentially speaking, there are 4 areas of pharmacy practice. You could divide it into 2.
Okay.
2, they have commercial component. 2 have exclusive professional component. For instance, you can go into pharmaceutical manufacturing. There are 2 sources of drugs in this country: pharmaceutical manufacturing, which account for about 40 to 45%,
okay,
and the importation. You bridge up with importation.
Okay, so bringing this to
you can import. You can go into pharmaceutical manufacturing even if you're not a pharmacist, provided you satisfy the requirement. You must have a
pharmacist. So in satisfying that now,
yes,
how is the council regulating?
The council regulates that because there must be a pharmacist on the board of directors.
Okay.
Either manufacturing or wholesaling.
Okay.
There must be a superintendent pharmacist. Either way, there must be a production pharmacist in the facility. Okay. There must be a quality control pharmacist. Do you understand? So if there are any professional misdemeanor, misconduct, the pharmacist will not be invited to the investigation panel.
To search. Okay.
But taking the professional component is the community pharmacy, retail pharmacy, and hospital pharmacy, because that is not a business, it's a practice. It's one-on-one. Exactly.
Okay. All right, Professor Ahmed Johnny Mora, we're going on a break now. So when we get back from the break, we'll take a look at other areas that the council, that's the Pharmacists Council of Nigeria, is actually making incursion to ensure that the sector is well regulated and people are on board with what is happening in terms of global best practices.
Thank you.
We'll be right back after this break. You're watching On The Spot. Yes, welcome back. If you just tuned in, the program is On The Spot, and I have the chairman of Pharmacists Council of Nigeria on the spot. Okay, Professor Mora, let's get back to that area of synergy between the different agencies of government that are into regulation, especially when it concerns our consumption of either drugs or some other substances to actually make us well. Let's get your synergy. How strong is this, and how effective has been the collaboration over the years?
Well, these are called national regulatory agencies, drug regulatory agencies. We're talking about the Pharmacists Council, which is responsible for the premises where folks can access to get their medicine. We're talking about NAFDAC, National Agency for Food and Drug Administration and Control, which is responsible for the registration of drugs, food, medical devices, detergents, chemicals, bottled water, and so on. And we're talking about National Drug Law Enforcement Agency. Now, NDLEA. Luckily, by virtue of my position as the chairman of the council, Pharmacists Council, I'm a board member of NAFDAC. There's also representation of NDLEA and NAFDAC. Okay. But the only missing link is the representation between NAFDAC, NDLEA, and Pharmacists Council. Okay. But it's very obvious because Pharmacists Council is responsible for licit products. Okay. That's a control, whereas the NDLEA is illicit product and so on.
So in bringing them together?
We are bringing them together. Even yesterday we were at the Interpol. I think there is a collaboration that we now want to come together under one page and look at how to tackle the drug system in this country. It's not something that I can say openly here now, but then Pharmacists Council, NAFDAC, NDLA, and the Interpol.
I know you talked about issue of watching out for what is substandard and also falsification of some of these medicines. And recently, at one of the briefings from PTF, there were concerns about some hand sanitizer not actually having the backing, or at least the mark from NAFDAC and some other agencies that are supposed to be regulating this. Is the Pharmaceutical Council too not bothered about this?
Well, there are, you see, that's why I mentioned the issue of a hospital formulary is very important. Within the hospital premises, the hospital pharmacy, the pharmacist is licensed to produce what we call extemporaneous preparation, just for the hospital, not for ourselves. So that one is extemporaneously prepared locally for use, but not for, it's not an automated production for sale. That one will not require any kind of licensing from NAFDAC. It's for the local use. And so we are really bothered about that. But if you have to produce somewhere automated under an industrial setting, there must be NAFDAC registration number. That some products are on the shelves with that NAFDAC registration number is actually cause for concern. Of course, naturally, when we go out on raid, when we go out on inspection, when we see those products, we'll actually remove them because they are harmful to the populace. Yes, but the point is that within the hospital pharmacy practice, they are entitled to produce extemporaneously. All
right, let's get to another area of your interviews. You talked about plans to computerize drug distribution system. This is something that you're passionate about too.
I'm very passionate about that.
Yes.
Actually, drug distribution is an area, I've written a book on that. I think the first book on drug distribution, that's the lizard-shaped model on drug distribution in Nigeria. It was launched on the 17th of May 2014 in Kaduna, and relaunched again on 19th of February 2019.
So why is this important for us?
It's important for you to know that because the drug distribution is such that pharmaceutical products are not ordinary convenience items. They are manufactured by pharmacists. They are sold, dispensed under the supervision of pharmacists, and so they must be distributed within a corridor. That is from manufacturing to wholesaling to retail pharmacy and the hospital pharmacy. So the issue is we will want to know who is getting what, and that is why we're talking about to pay courtesy visits on some organizations, federal government organizations that have to do with computerization in such a way that from the manufacturer to the wholesaler, from the importer to the wholesaler, from the wholesaler to the retailer that is going to pharmacy, and from the retailer and from the wholesaler to the hospital pharmacist, we should be able to computerize it so that we know the movement of all the drugs all over the country. And in case of bad formulations, we can easily recall. I'm sure you've heard about some instances in the past whereby some products were produced and such that it has caused the lives of some persons. So with this kind of system, we'll be able to recall. But the most important is so that we know the movement. Any pharmaceutical product, any pharmaceutical premises which is not licensed by Pharmacists Council is an illegal premises. Just like any product which is not licensed by NAFDAC is a fake product.
That's at least that puts to check some of the things that we're looking forward to seeing very soon. Now, at the beginning of the program, I talked about the issue of the pandemic leaving the whole health sector on their put them on their toes to actually see to a vaccine. So, and it's a race against them to actually do that. It's a race against them to actually quell the pandemic noise all over. How is the system in Nigeria looking out to doing it? So are we waiting for something from the East before we put out what we have?
Luckily enough, the Director General of the National Institute for Pharmaceutical Research and Development, NIPRID, is a member of the Governing Council of Pharmacists Council Nigeria, and we are talking about this. I'm sure you must have read in the papers that they are looking at some immune boosting products, and there are some herbal preparations that I also read that under scrutiny by either NAFDAC or NIPRID or both of them, about 23 of them herbal preparations. These are things that have to do with modern day technology, which I'm sorry to say that we are not yet quite there. But nothing, I mean, Madagascar produced the herbal preparations, and It's being studied now. Who knows? The cure might be from Africa. It might be from Nigeria. It's quite possible. But right now there's no cure and there's no vaccine for it. But there are the pharmaceutical industry, it's a dynamic one. Whatever happens, say in Australia today, reverberates in Canada. Whatever happens in South Africa reverberates in Denmark, and the whole world is knitted together. And whatever is the race against time. Let me put it that way. Yes. Okay.
I know your title, Wakili Magani, is something endearing to the people of Zazo, that's Zaire now, and also even elsewhere in Nigeria. I'm sure we want to tap from the wealth of experience. Why I raised that, there have been concerns even about issue of drug usage and abuse amongst the youth and even a cross-section of the society. How are you poised to actually use your title to actually look into some of those areas, and what had been the response since you were given the title?
Well, yes, it's a good one, because the Wakili Magani actually puts me as a representative of His Highness the Emir of Zazo Alhaji Shehu Idris. I mean, as you know, Zazo Emirate constitutes of 11 local governments out of the 23 local governments of Kaduna State. In terms of that, and we have planned some kind of sensitization workshop and advocacies for these kids off the street. So many of them that are doing some artisan work, some of them are commercial riders, some of them are roadside mechanics and so on, to the extent that they wouldn't have to be on any kind of psychoactive substance or any mind-bending pharmaceutical product for them to be able to work, as it were. And then I'm a member of the National Institute, and the National Institute has appointed me to be a chairman of a drug abuse committee, and we're looking at the component of drug abuse, the menace of drug abuse, actually most importantly in northern Nigeria. And because this leads to this insurgency, this kidnapping, and killing of people all over the place. Ordinarily speaking, you find that human beings do not do these things just like that until they are under the influence of drugs or so. So we are looking at that because of, again, you look at it from the socio-cultural aspect of northern Nigeria, core north and so on, because of the lack of consumption of alcohol and so on. So some of the youth tend to take these drugs, whereas it's the same thing, because you're not supposed to take alcohol and intoxicants. So that is the issue. And we have produced a blueprint in order to address the situation, as it were.
Okay. Now, let's push further in the area that PCN is taking a look at some other conditions of drug retailing distribution, as you have already pointed out. We know aspect of marketing too, if not because of the COVID-19 outlook on the world. We have to shut our borders to, or borders of most nations have been shut against our importation and all of those ones. Now supporting the industry in Nigeria in terms of production, then most likely we will have to export, of course, which some of us, some of your people have been doing. Let's take a look at our drug industry generally, pharmaceutical industry generally. What kind of support do they need? What kind of concerns do they have?
Now, this is a very good question, because let me just take you back memory lane. On between the 12th and 13th of December 2002, there was this workshop by the Center for Development of Enterprise, Center for the Development of Industry now. It's an EU initiative, and we had a meeting, and a small subcommittee was established, and I chaired that committee to look at the manner of improving capacity utilization of the factories within West Africa ECOWAS region. And I came up with the name WAPMA, West African Pharmaceutical Manufacturers Association. Yes, my committee did that. We coined that name, and I became the first interim chairman of WAPMA in 2002. And then we had to now liaise with the francophone and we are anglophone here, and the lexophone, that is Portuguese speaking countries and so on. I had to get the translation of the letters to all this and so on. So we said, let the headquarters be in Ghana, because we are the giants as far as pharmaceutical manufacturing is concerned. And there was this aspect of fake drugs in Nigeria making the rounds that time and making everybody uncomfortable. So let's make the headquarters elsewhere so that people do not be relaxed with it. So the headquarters is now actually in Ghana, and we have to make sure that to improve the utilization of the production of active pharmaceutical ingredients and then excipients and then through interest possible from the banks.
So they all played out?
Well, they are playing out actually gradually, because right now the civil intervention is purely in the face of this pandemic, which I've looked into, and a lot of companies have actually keyed into in order to get loans and at almost single-digit interest in order to be able to expand their capacity utilization so that people can now have drugs at ease.
Okay,
yes.
All right. I'm sure we'll have more and more to talk about.
Well,
but of course,
yes.
when it's becoming more interesting and you're catching all the fun to have knowledge,
yes.
your time definitely is not on our side. So I'd like to thank you so much, Professor Ahmed Tijani Mora, for coming on the spot.
Thank you.
And I would have loved you to just say something in 10 seconds. Your vision for this sector is big. My vision is be able to bring all the healthcare professions together, because the most important thing about healthcare profession is not just the patient but the system. We have to have a workable system between the medical practitioner, the pharmacist, in fact right from the medical health record officer, once you access any healthcare facility, down to the pharmacy. You see the pharmacist last. So there must be that synergy. Luckily, when I was the registrar of the Pharmacists Council, I was the chairman of the committee of registrars of the health profession for 6 years. And we were able to blend together. We have to synergy is key for all this.
All the health that will work together. Yes.
All right. Wakili Magani Zazzau of the Zazzau Emirates and chairman of the Pharmacists Council of Nigeria, Professor Ahmed Tijani Mora. Thank you very much for coming on the spot. We appreciate your time and your insights on the program. Last on the spot for this week. To join us for another interesting edition. You can watch this edition and other interesting editions on www.youtube.com/NTA News 24 Hub. My name is Blessing.